Okay, we're going to get started. My name is Rebecca Bernhardt, and I am the program director for Texas Physicians for Social Responsibility. We are co-sponsoring this event with the Southwest Center for Occupational and Environmental Health, and I would like to introduce Dr. Todd Sack, who's our speaker this evening. He's a gastroenterologist in Florida and a clinical professor of medicine. He's also the executive director of My Green Doctor and the board chair for the National Physicians for Social Responsibility. Dr. Sack, take it away.
Thank you so much. It's a great pleasure to be with all of you tonight, and I thank you for giving us this hour to talk about how we can add sustainability to your office practices. Let me go ahead and try to screen share here. So welcome everyone. My apologies for that delay. Teams can be funny in that way. My name is Todd Sack, and the talk we're going to talk about today, and I want this to be more of a dialogue than really a talk on my part, is greening your medical practice, reducing the carbon footprint of your practice while saving money. Next slide. Where am I running it? There you go. So as Becky said, and by the way, I want to thank Becky Bernhardt, who's the executive director of PSR Texas, for inviting me. And also I want to thank those at UT Houston who have made this CME program possible for us, Sylvia Santiago and Serena Holguin. Thank you to two of you. So as Becky said, I'm an associate clinical professor at the H. Wertheim College of Medicine in Florida, where my research is on how best to teach about climate change and health. I've chaired the Environment and Health section of the Florida Medical Association for a decade. I was in the past delegate to the American Medical Association, where I helped the AMA adopt policies on environmental health and climate change. I give lots of talks on climate change and sustainability to community groups. I'm executive director of the My Green Doctor Foundation that I'll talk about in the last third of this talk, and I'm president of Physicians for Social Responsibility in Washington, D.C. Next slide. And I have no personal, financial, or professional interest to disclose. Next slide. Just a word about Physicians for Social Responsibility. This is an equity-focused nonprofit, been around since 1961, and shared in the Nobel Peace Prizes of 1985 and 2017. We're health professional members in 20 state chapters, and we address the existential threats to mankind: nuclear war, climate change, and environmental toxins. And we have lots of online resources and tools for advocacy on these topics. Take a look at www.psr.org. Next slide. And since I'm president of PSR, I just want to just say a word about what we're up to this year. We have a new executive director, a wonderful man, Brian Campbell. We have a 21-person board of directors, and we're honored to have two Texans on the board, Adelita Cantu, who's the president incoming of PSR Texas, and Steve McKee, who was executive director for PSR Texas in the past. And we're about to embark on strategic planning, which is going to highlight strengthening our chapters, building membership, and recruiting more advocates to our work, working on this topic of intersectionality, how our climate work and peace work intersect in many ways. We'll be talking about equity, focusing our board, our staff, and our programs. We talk about strategic collaborations, because most of the work that Physicians for Social Responsibility does is in collaboration with our chapters and with other nonprofit organizations. And we're going to do a lot of mobilization of our community for this upcoming election. Next slide. Well, let's get today's talk, greening your medical practice, reducing the carbon footprint of your practice while saving money. And this is kind of a different kind of talk. We're going to give you lots of sort of background understanding of why this is an important topic, but also give you tips that you can use to begin in your practice. Next slide. Following this talk, I hope you will know why climate change is important for health professionals and practice managers. Be aware of some of the barriers to sustainability in our office settings. Know what free resources are available for greening hospitals if you work in a hospital and medical practices. And I'd like you to come away from this hour feeling confident that you could lead a sustainable environmental sustainability and climate change program in the outpatient clinics where you work. Next slide. Oh, go back one, please. There you go. There, thank you. Overall, I want us to keep in mind the health threats of climate change to our patients and our communities, and the imperative that we as a society abandon fossil fuels for energy generation. Next slide. I'm not going to talk a lot about the climate change and its health impacts. I think you've had other talks in this series on that, but just on the left, you see the key climate change effects from a geological standpoint: rising ocean, rising temperatures, rising sea levels, and then extreme weather events, extreme heat days, extreme rainstorms, hurricanes and tornadoes, flooding and droughts. And on the right are the health impacts that we're already seeing. The most important is heat-related deaths, with many tens of thousands of deaths around the world every year from extreme heat events, but also asthma and heart attacks from the pollutants and fossil fuels, cancers again from the pollutants and fossil fuels, emotional illness, emerging infectious diseases like Lyme, Zika, malaria, malnutrition and famine, and then this concept of climate refugees, which is increasingly becoming a problem. But I'm not going to today talk in detail about those health effects. Next, let's go. There we go. Go forward one. Go forward one, please. There you go. I just want to point out that 2023 was marked by tremendous disasters. There's a noisy dog in my apartment. Worldwide disasters that are really unprecedented in recorded human history. Wildfires in Canada that burned 10 times more acreage than an average year. 15 million acres as of August of last year. Earth's hottest recorded month in human history was July 2023. 101 degree Fahrenheit waters off of Florida's coast, contributing to massive coral reef deaths, and then extensive wildfires throughout the country, and particularly there we are in the Southwest. Next slide. And more disasters in 2023. Flooding in Vermont after deluge rains. Phoenix, 110 degrees Fahrenheit or hotter from June 30th to July 30th. Record wildfires on the Greek islands. The heaviest rains in China in 140 years. Record-setting heat waves in France, Italy, Japan, Southeast Asia, with many, many tens of thousands killed in these events. Glaciers in Greenland and Antarctica melting 3 times faster than they were just 30 years ago. Thousands dying in flooding from a tropical storm that led to a breach of 2 Libyan dams. And very little action taken at the recent and very disappointing COP28 summit in Dubai. Next slide. And the important point is that this is a decisive decade when the world really must begin to act. International panel on climate change states with very high confidence the risks and adverse health impacts from climate change will escalate, that the deaths and damages will disproportionately affect the poorest, least developed countries, especially in Africa, and that to keep within a 1.5 centigrade increase from the historical temperatures, we must reduce emissions dramatically over the next 15 years. Next slide. So I've stated why this is important in general, but why is this important for we who work in our offices, we health professionals and practice managers? Well, healthcare has an impact on climate change itself. In fact, climate change is responsible for 4.4% of net air pollution and greenhouse gases globally. Our industry in the United States, our healthcare industry, emits about 27% of global healthcare emissions, and 8.5% of all U.S. emissions, all U.S. Toxic air pollutants, all U.S. greenhouse gases come from healthcare. And if you look at the health impacts of all this air pollution, it leads to 405,000 years of lost life annually in the United States alone. So even as we do good in healthcare, saving lives, making people healthier, improving their quality of life, the fossil fuels that are burned for the work that we do leads to significant injury and illness. Next slide. Well, how about our offices? How are they important? Well, it turns out that outpatient care is responsible for about 26% of U.S. healthcare's toxic air pollutions and greenhouse gases. There are millions of healthcare offices worldwide. We buy lots of energy, water, equipment, and other supplies. It turns out our prescription habits matter, that some pharmaceuticals are more greenhouse gas producing than others, particularly when you look at the inhalers used in asthmatic and other chronic lung diseases. There are huge opportunities for us to save resources and money in our practices. Health professionals are highly respected, and so we have the ability to influence the choices made by our patients by teaching them wise choices. And finally, we have the ability to reach those climate vulnerable communities who come to our office. Next slide. This is another schematic demonstrating the role of greenhouse gases in our industry. This looks at U.S. healthcare's greenhouse gases by service type. And you see, not surprisingly, that hospital care with its gigantic behemoth buildings is a substantial portion of healthcare's greenhouse gases, about 36%. But our outpatient care is important as well, sitting at about 26%. Other factors of healthcare include construction and manufacturing, prescriptions, retirement and nursing home care, and other services. So our patient practices really do matter. Next slide. Let's go back, please, and go forward. Okay, go back, please. Great. So I want to talk about the often heard barriers to going green. Why don't we have sustainability in our offices? Well, the kind of things I hear as I talk to practices around the world is, well, this isn't our mission, or we're too busy, or it's too expensive, or there's no one to lead us, or our practice leaders aren't interested, or we simply just don't know how to approach environmental sustainability. Well, in the next 20 minutes, I'm going to answer each of these in a way that you'll come away, I hope, confident that your healthcare practice can move ahead with environmental sustainability. Next slide. Go back one, please. Thank you. So what are the benefits to practices of environmental sustainability? Well, it saves saves money by lowering overhead costs. Typically, a practice can save about $1,000 to $1,500 per doctor per year. It decreases the uses of energy, water, chemicals, and other resources, improves office teamwork and staff morale, enhances the office experience for patients, improves the practice's public relation profile and trust. You see, our patients really enjoy seeing that their health professionals involved in looking at health more broadly than just today's blood pressure or today's prescription. It really does improve the trust they have in our work. Like sustainability creates a healthier office as we choose healthier chemicals in the workplace. We have the ability to choose wise choices, money-saving choices, in many cases by patients and families. And finally, the bottom line is we can improve community health by encouraging sustainability in the community. Next slide. Go back a couple. There you go. Oh, one more. Go back one more, please. Thank you, Becky. So I want to talk a bit about regulators. It turns out that keeping ahead of the regulators is another reason to think about environmental sustainability for your own practice. And I'm going to kind of in the next couple slides talk about what's coming to industry in general and what's coming to healthcare. For example, the European Union will require all large companies to report certain sustainability data by January 1, 2028. In the United States, U.S. Security Exchange Commission announced reporting rules for large companies in March of 2022. Now, this didn't go very well, and the SEC withdrew those proposed rules, but they're definitely coming back with new ones. In New York City, buildings are required to begin reporting greenhouse gases starting in 2024. Interestingly, our large hospitals in New York City were able to get themselves relieved of that burden, but it's coming. California is requiring broad-based climate-related disclosures by large businesses beginning in 2026. Specifically in healthcare, the National Academy of Medicine is studying how to achieve and require a net zero healthcare. That is, that our healthcare industry would not produce any net greenhouse gases. Next slide. So what are the specific requirements that are likely to come within 10 years? We'll be asked to report on the climate change resilience of our businesses. For example, are we prepared for an extreme heat event or flooding event or extreme weather events such as a hurricane. We may be asked to report on how our business model affects the environment, effects on marine and water resources, waste and pollution from businesses. And some businesses are going to be asked even to describe their impacts on biodiversity. We'll be asked to keep track of our scope 1, 2, and 3 greenhouse gas emissions. And this is a concept, the scopes of greenhouse gas emissions, that I'll explain in a few minutes. And cost of compliance will be significant. And there's even already talk of penalties for industries, not to exceed $500,000 per year in one proposal. So this is the kind of language that we're seeing in regulations around the world, including the United States. Next slide. I want to explain scope 1, 2, and 3 because this is a very important concept. This is to look at greenhouse gas emissions from a business by its scope type. Scope 1 greenhouse gas emissions are from on-site combustion of fossil fuels. For example, perhaps in your building you have a boiler that burns fuel oil to heat your building or to create your hot water. So that'd be burning fossil fuels on site. Scope 2 is the greenhouse gas emissions from making the electricity that we buy. And scope 3 is from the products and services we purchase, such as the greenhouse gas emissions for manufacturing, packaging, transporting, or disposal of products. So let's look at how what scope 1, 2, and 3 emissions break down in our industry, in our healthcare industry. Next slide. So it turns out that it's the products and services we purchase, that scope 3 type, that have the largest climate change and health impacts. If you look on the left, you see that scope 1, which is burning fossil fuels on site, is a very small portion of the greenhouse gases from industry. Scope 2, the greenhouse gases from the electricity we buy, also pretty small, but it's those scope 3 emissions, the food, pharmaceuticals, medical devices, and other things that we do. And we'll be asked to keep track of those in the years ahead, to keep track of particularly these high impact scope 3 emissions. So the things we purchase are going to be something we're going to look at carefully in the years ahead. Next slide. So the Joint Commission on the Accreditation of Hospitals already has a sustainable healthcare certification program. If you're a hospital or a big company, a healthcare company, you can already begin this. There are 5 required steps to being a sustainable healthcare certificate earner. You have to have a greenhouse gas reduction strategy. You have to appoint administrative and clinical staff to oversee reductions. You have to measure at least 3 greenhouse gas sources from your company. You have to adopt and implement a greenhouse gas reduction goal. And finally, do annual reporting. And many big hospital systems are already beginning to step up the plate and begin to qualify for the Sustainable Healthcare Certificate program. And if you are managing a hospital or working in a big hospital, this is something you want to look at carefully, because your insurance companies, sometimes even your customers, your patients, are going to be asking whether you are Joint Commission certified sustainable healthcare provider. Next slide. So in conclusion, on keeping ahead of the regulators, it's important to know that regulations will make environmental sustainability a required part of your business model. I predict sometime 5 to 10 years from now. Medical practices will need to develop expertise in environmental sustainability. Medical practices that begin their sustainability journeys sooner, I believe, will be less disrupted, happier, and more successful. And as we're going to talk about in a few minutes, there are already excellent management tools available to make this fairly easy for you. Okay, next slide. So we've talked about why climate change is important to health professionals. We've talked about some of the barriers that we encounter approaching this topic. Next, let's talk about what free resources are available for greening hospitals and medical practices. Next slide. So let's go back one, please. Sorry, Becky. All right, environmental sustainability and climate change resources for hospitals. If you work in a hospital, these are the 2 most important resources: Healthcare Without Harm, with a great website, noharm.org, and American Hospital Association's Sustainability Roadmap. Healthcare Without Harm is a really important organization. It's been around for 30 years. They're on most continents now, and they offer really clear templates for how to approach sustainability and usually save money by big hospital systems. If all you do, if you work in a hospital, is ask your hospital manager, hey, are we part of No Healthcare Without Harm, and encourage them to sign up, you'll be making a big impact. What they work on is topics like energy use and renewable energy, reading the supply chain, waste management, reusing products, recycling, attention to the packaging on products, trying to minimize the use of non-essential plastics, greening the hospital supply chain, getting at those type 3 emissions, looking at the climate warming anesthetic gases, which are generally about 1,000 times more climate warming molecule per molecule compared to carbon dioxide, looking at transportation choices, food choices, etc. So Healthcare Without Harm, a really important resource for hospitals. Next slide. But now I want to talk about the free sustainability resources for medical practices. There are 4 that I like, and I kind of recommend using bits and pieces of them, although we're going to talk mostly about My Green Doctor. The ACP, the American College of Physicians, has an excellent climate change toolkit that's free online with lots of brochures you can give to patients on topics related to sustainability, climate change, and health. The Green Impact for Health program is produced by the Royal College of General Practitioners in England. It has an excellent score sheet for keeping track of what your accomplishments. It's a little bit UK and primary care focused, but it's an excellent guide. Canada has the Green Office Toolkit, which has many projects that an office can embark on. And finally, My Green Doctor, which is the program I'm most familiar with, which is located at 2 websites, mygreendoctor.org in English and mygreendoctor.es in Spanish. Next slide. So I'm going to spend the next 10 minutes explaining how to use My Green Doctor. This is a complete environmental sustainability practice management program. It's located at 2 sites, as I said, mygreendoctor.org in English and mygreendoctor.es in Spanish. My Green Doctor is used in many different countries, more than 15,000 users in 2023, including many in Spanish-speaking countries by Spanish-speaking health professionals and patients. Now, 29 organizations, including Physicians for Social Responsibility, provide My Green Doctor to their members as a free membership benefit. My Green Doctor is comprehensive, science-based, non-political, and very easy to use. It's for really any outpatient clinic, practice, or outpatient center, and most offices save money in the first month using My Green Doctor. Next slide. So this is a membership benefit if you're a member of Physicians for Social Responsibility, including in Texas. And when you register at My Green Doctor, you get a free pledge certificate for your waiting room and staff break room. You get free complete access to My Green Doctor's practice management program for your entire staff, which is a $450 value the first year, in addition to the savings you'll get from using fewer resources. And I'll tell you that most of these resources are available without paying or without being a member of PSR or one of our affiliate organizations. But to get full access, you need to be a member of one of their affiliate organizations. You also get 1 hour per year of free consultation from My Green Doctor volunteers. You have the option of purchasing 4 hours of concierge consulting. In addition, you get free patient and staff teaching materials, including lots and lots of brochures, and free you get for free our recognition certificate once your practice qualifies for our practice management program. Next slide. Oh, go back. There you go. Thank you. This is an example of the free sustainability pledge certificate that anyone gets who registers at My Green Doctor, even those who register at our basic green free level. And the pledge certificate says that this office is pledged to improve the environmental sustainability of its practices and is committed to informing its patients and the community on topics such as energy efficiency, water conservation, recycling, solid waste management, chemicals in the workplace, transportation choices, renewable energy, climate change, and healthy food. So these are the topics that you'll be working on as you use the My Green Doctor program. Next slide. What makes My Green Doctor work and makes it so easy is what we call the meeting by meeting guide. What this is a complete script for each clinic management meeting. So if your clinic meets every 2 weeks to talk about business matters like EHR and referrals and billing and complaints and all those sort of things, we ask you to add 5 minutes of My Green Doctor to each meeting agenda. And the meeting guide explains exactly what to say at each meeting. So there's really nothing for the office manager or physician leader to study or prepare. We don't ask you to become a sustainability officer or a tree hugger. You don't have time for that, honestly. My Green Doctor focuses on slow, steady improvements, making 1 or 2 changes at each of your monthly business meetings. There's an emphasis on patient and staff teaching. We encourage staff discussion and staff involvement, and there's a green team notes form for easy record keeping. And after you've had 5 meetings, you submit your notes to us, and you've earned your Green Doctor Office Recognition Certificate. Next slide. So these are some of the topics in the meeting by meeting guide. You see on the left the pledge certificate that we already talked about, but the topics are what you'd expect: energy use, adjusting thermostats, turning off lights at night, turning off computers when you can, choosing the right appliances that use less energy, and even purchasing or generating on-site renewable energy. We talk about products, reusing them, recycling, avoiding styrofoam and unnecessary plastics, minimizing your waste, maybe even choosing biodegradable gloves, prescribing habits, selecting the best choices for the environment and the patient when prescribing medications, particularly those inhalers, healthy food choices, healthy for the patients, healthy for the environment, choosing chemicals wisely, particularly in your cleaning products and insecticides. And I encourage you in your home and in your practice to only choose cleaning products from the Safer Choice U.S. Environmental Protection Agency list of more than 400 cleaning products that are available. Water conservation, transportation options for the staff and patients, and finally, lots of emphasis on patient education. Next slide. We have lots of brochures that you can print for patients to take home, available in multiple languages. Your Healthy Home brochures on lots and lots of topics. Climate change, how to protect your family, surviving extreme heat, air pollution and wildfires, in a changing climate, healthy eating for your family and for the environment, green cleaning, and many other topics. And some offices simply provide the patients this QR code so they can use the brochures in multiple languages at home on their own computer. Next slide. How about green teams? My answer is no. So what is a green team? A green team is when your practice says, well, we're going to find 3 or 4 people interested in sustainability, and we'll put them in a room and they can come back to us a few months with ideas that we might try in our practice. My experience is that when a practice sort of sets up a green team, that it always fails. The reason fails is several. Partly is that if you find 2 or 3 people or 3 or 4 people interested in this, typically someone can't come to lunch because their clinic ran late, or they're on call, or someone's out ill, or someone's on vacation, and after a few months the green team falls apart. Better to add a little bit of sustainability to your regular business meetings and include everybody in this process rather than forming a green team. Next slide. So I'm almost done. I want to share with you some success stories and then let you know how you can get started in your practice. This is the first success story. This is from the Escambia County Health Department, which is 5 offices in the Florida Panhandle. They've been saving energy every month since they began using My Green Doctor. The first year they saved 5.2%, and their electricity bill, which ended up being 125,000 kilowatt hours of electricity saved per year, 85,000 metric tons of carbon dioxide not created. At the bottom line, they've been saving $14,000 plus every year. On the lower right, you see a photo of solar panels they put on one of their buildings one year with the money that they'd saved. Next slide. Second, go back another, please. Go. There you go. Next, second success story is from Allergy and Asthma Diagnostic Treatment Center in Tallahassee, Florida. This is a single office practice. They've earned the Green Doctor Recognition Certificate. You see one of the members of their team holding the certificate. Topics they addressed included water conservation, energy saving, using a lot less hot water, turning off lights at night, installing smart power switches to turn off lights when people leave the room. They have a nice recycling and recycling education program for patients and staff. They've decreased their paper and printing, and they have put brochures, signs, and handouts in the waiting room for the patients. Next slide. Okay, how to get your practice started in 5 easy steps. Well, first, register My Green Doctor, and I welcome anyone on this call to use the discount code MGDPSR, My Green Doctor PSR. You'll register as a partner society member. Using the discount code, My Green Doctor becomes free for you and for anyone in your staff who wants to use the same discount code. Watch the 3-minute video on the homepage. This simple 3-minute video explains how to use My Green Doctor very easily. Plan to add 5 minutes of My Green Doctor to every staff meeting agenda. Just expect to see sustainability on the agenda. Make small, steady improvements in the practice at each meeting using the meeting by meeting guide to guide you. And finally, commit to qualifying for that Green Doctor Office Recognition Certificate. Having that goal, something to be proud of, is really important to make sustainability a sustainable part of your practice. Next slide. Did we miss one? Go back if you could. No, I guess we didn't. Next slide. So today's talk, we talked about why climate change is important for health professionals and practice managers. We talked about some of the barriers to sustainability in the office setting. I wanted to know what free resources are available for greening hospitals and medical practices. And I hope that now you feel confident to lead a sustainable environmental sustainability and climate change program in your clinics and offices. Next slide. So I think we missed one. Go back one if you can. Here we go. I want to thank you for helping your members to go green, the members of your practice, the members of PSR. Remember that discount code MGDPSR. My email address and my phone number is there. I welcome you to call me anytime or anyone in your practice to help with your sustainability journey. Next slide. And I thought I'd list some possible discussion questions because we have a few minutes left, and I'll just kind of read them, and then maybe we'll get off of a slide share and just talk. Does your practice have an environmental sustainability program? If no, why not? And if yes, please tell us about it, maybe how it got started and what has worked and maybe what has not worked. Do you think an environmental sustainability program would be helpful for recruiting young office staff and health professionals? So it'll give you a little advantage in the recruitment market by having sustainability something to offer to young health professionals. Do you believe that teaching patients and families about climate change is something that health practices should be doing? And finally, what could PSR or your health professional society do to help your practice to go green? So with that, I'm going to thank all of you for attending, and thank you again to Becky Bernhardt for inviting me to talk. And thank you to UT Houston for doing the CME for us. And let's talk. Any questions or comments or ideas? Becky, I didn't know if there was some in the chat you wanted to start with.
I am taking a look. I don't know.
I have a question.
Thank you.
So this is Lisa Doggett. Thank you so much. That was really inspiring. And I especially loved hearing those success stories. And I am brand new to my practice. I don't know enough about how all of this works to really necessarily make a recommendation, but I've just made some notes to do that when, hopefully in a couple months when I've been there a bit. But all that said, what have you seen as the biggest barriers to making these changes? You mentioned some of those at the beginning, but when a practice commits to doing this, what tend to be some of the parts where there are places where they're getting stuck, and how do you get out of that or avoid it?
Great question. The trouble is we're all so busy as health professionals and office managers giving healthcare. When we started My Green Doctor 14 years ago, we asked practice to put a whole hour into this every month, and nobody could do that. We're just too busy. But when we switched to asking offices just to commit to 5 minutes at each monthly meeting, it's had traction, and we saw a huge change both in the number of people registering and in people completing our program over the last 4 or 5 years. My recommendation is register yourself, watch that 3-minute video, and then talk to your practice manager or your lead physician and say, hey, I looked into this. This is something we can do. Now, if you're a health professional, if you're a busy nurse practitioner or a doctor, maybe you won't be the person to lead this process, but your role may be just to tell those in charge how important this is and expect to see it on the agenda of each meeting. That's an important role for you as a newcomer to the practice. Just ask that it get on the agenda.
Great, thank you.
Todd, can I ask a question?
Of course.
So I feel like a lot of folks are in, managed practices that are kind of big and have a sort of a big kind of corporate organized medical something over the top. Do you have any suggestions for like folks who are in that kind of practice to, pitch this to the leadership and be able to get their attention?
Yeah, if you're part of a big hospital system, typically the hospital have a sustainability process for the big hospital building, but very few have looked at their clinics. So one of the things you can do is to talk to the sustainability team in your hospital system and say, hey, can't we do this at our clinics? And then there are 2 ways they could do this. We actually have if they want to do it a top-down approach, that is, the organization asks all of their clinics to operate with My Green Doctor or one of the other programs. That's one way to do it, top down. And we actually have a practice management policy and procedural manual on our website that a big hospital system could use to implement My Green Doctor across all their clinics. So top down is one approach. Ask your big boss to look into that. But the second is just to start out in your clinic. Speak to the office manager, even in a big institution. Say, hey, why don't we try this? And you may have some traction there.
Looks like everybody's quiet.
So I have a question. This is Lakshmi. Wanted to see if you can briefly mention some options for hospital systems like Practice Green Health and its membership signups and toolkits that are available, because several people do work in a hospital setting.
Yeah, I did. I always talk about Practice Green Health and Healthcare Without Harm in my talks, and I did earlier in this talk as well. I'm a huge fan of Practice Green Health, which is one of the programs under the organization called Healthcare Without Harm. And I recommend, if you work at a big hospital, ask your administrator to belong to Healthcare Without Harm and use the resources at noharm.org and their Practice Green Health resources for greening the hospital. Unfortunately, they're kind of thin on clinics, but they're wonderful for hospitals. And I want to say one other thing about that. Most hospital systems now do have a sustainability committee. And if yours doesn't, ask your administrator to start one. But if they do, I really recommend you volunteer to serve on that sustainability committee. They need clinicians. They really need that clinical voice to make their work more effective. And you'll meet some really wonderful, inspiring people on the sustainability committee of your big health system. So join that sustainability committee. You'll be really glad you did. I hope I answered your question.
Yes, thank you.
Yeah. Does anyone have a good or bad experience with sustainability in their own practice?
Hear me, by the way?
Yes.
Oh, hey, thanks for your lecture. It was really great. Quick question. What about actually trying to get solar panels put in hospitals. Are you seeing anyone do that? We've talked about it, and I would say it's basically like a brick wall. Nothing can be done. It's impossible, and it will never be possible.
It's sad because if anyone owns a building with a roof and they're going to have that building for more than a decade, solar panels are a great investment. And that certainly applies to big hospital systems. For a big hospital system, it's such a small part of their overall bottom line that it's hard to get people's attention. But it's a great option for hospitals, and a few hospitals have done that. For a clinic, though, where you have a discrete office with a roof, it makes great sense. So if you own your own practice to buy, or you own your own home, to buy solar panels to take advantage of the $7,500 tax credit from the 2022 Inflation Reduction Act, great choice. So yeah, we should be putting solar panels on our homes and our offices. It's just we're so busy. You go to My Green Doctor, we have a really nice one-page blog on how to take advantage of the $7,500 tax credit for your own home or your business. So take a look at that. You'll see it under the short topics tab on the upper right. It's easy to take advantage and get this tax savings. It's wonderful.
Thank you.
Yeah.
And I wanted to add to that for the hospitals. The Inflation Reduction Act does have tax credits for for-profits, and those who are nonprofit, a tax, they just give you money for doing that. And the more rural the hospital, the more rebates that you may be eligible for. And there are some successful primers that you can look at, or at least case studies. Gunderson Health and Vision has a beautiful outline of how they went net zero from 2014. They were one of the pioneers, and they actually have those online. And the other thing is for generators for hospital systems or for healthcare, previously, it was required to have a generator as a backup. Now CMS has a waiver for microgrids, so renewable energy microgrids to, instead of generators as an approved backup energy source. So that also helps along with the CMS waiver and the IRA funds.
Absolutely. Gunderson is a wonderful system of hospitals and clinics in Wisconsin, Minnesota, and Iowa. They have a great website which brags about, as they should, their sustainability work. And at Healthcare Without Harm, noharm.org, they highlight Gunderson's really pioneering work. They've been wonderful.
For the folks who are in Texas, something else to know, we get a lot of misinformation about the unreliability of solar energy. And certainly if you have a microgrid, which means you've got batteries and you're charging the batteries during the day and then running off that electricity at night, that's not really a concern at all. But, something to know is that HEB actually years ago in the Houston area went to solar power because the local electric companies were so unreliable. And every time their freezers go out and their refrigerators, they lose all this produce, and it's really kind of catastrophic. So industries that are really dependent on keeping things cool have actually switched to solar because they can control it better and it's more reliable than, well, the local electric company in Texas. So.
Yeah, and that Inflation Reduction Act $7,500 tax credit can be applied to solar panels or to batteries. So it's a great deal. They reduce your tax bill by that amount of money. Why not get it in 2024? Plus, you'll pay for your solar panels in about 8 years, and you have free power for another 15 to 25 years. It's quite remarkable.
So, and another way to do it, and I think this is how HEB did it, is they basically leased their roofs, being that they have very big ones, to another company that put in the solar panels, sold them the energy back for not very much, and then was able to sell the excess on the open market.
Yeah. tell me to maybe, and to answer one of the questions I put in my last slide, do you all think that teaching climate change and health is something we should be doing in our practices to prepare patients for climate change?
Hey, Todd, this is Anusha. Thank you so much for this great talk. In two parts, I guess. In one, in answer to your question, I absolutely think, it's very relevant for our patients, especially in Texas in the summer when the heat is out. And we have lots of patients who, even if they don't have specific, heat stroke or heat exhaustion where they're in the ER, even in the clinic in the summertime, you just see lots more people with sort of heat related adverse symptoms, if you will, and things where they're unable to go to work or unable to stay at work, or they don't have accommodations at work. So I find it's very helpful to educate our patients on some of the climate related events that they're going to see and that they're facing, and it kind of helps them feel more empowered in terms of talking to their employers. And I know last summer Dallas had a program, I think like through the county, on like getting air conditioners set up for people who were under like a certain income limit and didn't have air conditioners. And so patients found it really helpful when we had those resources to give them, because I don't know that they're otherwise listening to the radio or finding them out themselves. So it's nice when they come in to kind of address those things, I think. Similarly, we have a talk in one of our med student electives that I run where we talk about taking an environmental history. And so the first time I heard the talk, I was like mind blown, because I don't think I'd ever thought about specifically medications that need to be refrigerated in the heat, or if you don't have a functional refrigerator, or if the electricity goes out because the power grid is overloaded. Some of those simple things that I think, at least I personally hadn't always thought about, especially here in the summer, and then with our, current constant winter freezing in February. There are things that are more on my mind, and so I try to make sure I've got dot phrases and things for our patients to kind of help jog their mind and kind of let them know what resources are available also. But the other thing was, as you had mentioned before, I'm curious to know, I've worked a little bit with our sustainability committees at UT Southwestern at Parkland. I'm not on the committees per se, but I know of the people who are on them and kind of the stuff that they've been trying to do. I'm curious, and I'll have to reach out to them and see if UT Southwestern specifically is a part of healthcare without harm. I was going to say healthcare for harm, healthcare without harm, and see if we're kind of following those recommendations. I'd be curious to know that.
Yeah, thank you, Dr. Govan. In Florida, where I practice, of course, all of our patients have a discussion with their primary care physician about having an emergency plan for the hurricane that's going to come about every 10 years. But I now talk to my patients about having a climate change preparedness plan. Where are you going to go on the extremely hot day when the power goes out? Or are you aware of the flooding risk from flash floods from that 4-inch of rain in 6-hour day that's going to happen in Florida cities over the next few years? So having that your family has in part of their emergency planning has considered the heat event, the extreme weather event, is extremely important. And it's part of the social history that we can add.
So we are getting close to the 8 o'clock hour, and so I guess we should wrap it up. Dr. Sack, if folks have additional questions, they can email you, or how should they follow up?
You can email me at tsac8@gmail.com, tsac8@gmail, or call me 904-403-6446. But most importantly, I would encourage you to register Migraine Doctor or one of the other resources for your clinic, and just talk to your manager. Hey, we can do this. This is something we'll be proud of. We're going to look back in 6 months and realize we've saved a lot of money and done a lot of good, and be very proud of it. And put those Green Doctor Office Recognition certificates in your waiting room and in your break room, and brag about it, because you've done something great for your community and your practice. Thank you again to PSR and UT Houston. Very grateful to be here tonight, and to all of you.
Thanks, y'all. Have a good night.
Bye.
Thank you.